As a key player behind Telfer Health Transformation Exchange, could you please briefly describe to us this initiative and how it has started?
The Telfer Health Transformation Exchange is a meeting place for business academics, clinical innovators, and business leaders who come together to connect, to collaborate, and innovate about solutions around healthcare delivery for the region. It expands across the region, involving players from all the hospitals and some of the institutions that are not necessarily hospital-based. These include the Ottawa Hospital, the MOFOR, Queensway, Elizabeth Briere, and other institutions that make up our health delivery environment. This is a very timely project on behalf of Telfer and the regional programs, in that healthcare is a significant part of our economy. It's approximately about 11% of GDP and growing at about 4%. It is on track to be quite unsustainable. And this is really driven through new technologies, new therapeutics, changing demographics, and as we've seen in the pandemic, really stress to deliver services in a complex environment. This has really ignited a lot of interest in how we can redesign healthcare systems to optimize them, to not only be sustainable, but to actually adopt new technologies. These are essential attributes that we need in the healthcare system to help redesign it.
Could you please explain how Telfer Health Transformation Exchange creates capacity both within the Telfer School and the healthcare system?
The exchange actually does its work through, I would say, three different sort of areas. Fundamentally, it's about building capacity. The Telfer School has been responsible for many of the administrators and health leaders who work in the region, and building out on our programs, both the Masters in Health Administration, PhD programs in health. We infuse clinical innovators to bring real-world topics to the educational programs. So we build capacity by training the next layer of leaders who participate in our programs. The other area we create capacity is through thought leadership. We are responsible for bringing many different sort of seminars to the region several times a year, where we bring thought leaders from across the world, from Australia, North America, some of the top healthcare services, including United Healthcare and others, where we exchange ideas about health innovation, health delivery transformation. This thought leadership also extends to discovery workshops that we have. The recent ones we had was focused on entrepreneurship and the use of our communities of practice platform to drive learning systems. The other way we create impact or leverage the capacity of Telfer to have impact is with our research agenda. You can break that up into two components. One is sort of individual research projects and sort of thematic projects. In individual research projects, we have a long list of interactions with many of the health services in the region, dealing with postoperative care and endometrial cancer, lung cancer care delivery, spinal surgery, predictabilities, pathology operations. And in fact, we even have projects working with Yellowknife, where we were participating or facilitating a redesign of the endoscopy services.
Could you tell me how activities of Telfer Health Transformation Exchange contribute to health system transformation and innovation?
Fundamentally, when we look at the need for health system redesign, we have two problems. We have a delivery problem, and we have an integration of the best science, clinical science problem. The business school and working with Telfer has personally helped me by exposing me to a cadre of similar thinking people who've allowed us to generate and iterate around new ideas, and especially around our learning health system concepts, which we are, I think, fundamentally is our fundamental paradigm we're trying to institute within the region. And for me personally, this has been articulated in a new program called the Cancer Care Collaborative with Telfer, where, as the medical director for the cancer program, we are working with Telfer and the exchange to facilitate how we might optimize and redesign cancer care in the region. So this unique collaboration between clinical innovators, business research faculty, is an opportunity to really bring best practices of business management, evidence-based approaches to system change to the clinical side, and is the opportunity to bring relevant clinical problems, real life work